right. Hi, everyone. Thank you for joining us for today's webinar, Make Revera Public. My name is Candice Jazvac, and I'm a member of the mobilization team at our PIPS national office in Ottawa. And I'm your host today. I'm joined by Linda Silas from the Canadian Federation of Nurses Unions and our own PIPS president, Debbie Davio. Welcome, and thank you for joining us, Linda and Debbie.
Hi, and thanks to everyone for joining us today. I'm thrilled to see that so many of our members are prepared to join this campaign to push to make Revera public. I know many of our members were shocked and upset to learn that our pension plan fully owns a for-profit long-term care company. Revera's for-profit model continues to allow much higher rates of COVID infection and death than in public facilities. And I really want to thank Linda Silas for joining us today to provide her expertise and her insight. Her membership has, that her membership has into this really important issue. Linda has been the president of the 200,000 strong Canadian Federation of Nurses Unions since 2003. That's a heroic fate in itself. And Linda is a passionate advocate. She champions greater understanding and action on social justice, the social determinants of health, as well as key policies that will enhance socioeconomic equity, like retirement security for all workers, a national pharmacare program, universal childcare, and greater access to public services for Indigenous communities. Linda is also, like myself, one of only a handful of national union leaders that are women, so we're really pleased to have her with us today. Thanks, Linda.
Bonjour, everyone. It's a pleasure and an honor to be here with Deb. She's one of my partners in crime at the Canadian Labour Congress, so it's always great to do anything with Deb. And also, it is so important that this topic is being talked today, and talked today by other than healthcare workers. It is a responsibility of society to take care of our elders, of our seniors, and COVID-19 has shown we have failed. So I'm so proud of your organization to have put this at the forefront, because we need activists like yourself to be talking about where your money, because pension money is your money, where is it going? So looking forward to the next hour.
Awesome. Thank you so much, Debbie and Linda. Before we begin, we would like to take some time to respectfully acknowledge that our office, located in the settlement now called Ottawa, is on the unceded and unsurrendered territory of the Algonquin Anishinaabe Nation. Before this land was a city, it was and remains a place for the Algonquin Anishinaabe people, whose presence here reaches back over 8,000 years. As settlers, it's our responsibility to educate ourselves on the history of the first peoples, to learn how to be respectful of their cultures, to acknowledge their pain and our part in it. This journey of understanding is uncomfortable, but that discomfort is part of discovering our past and taking responsibility for how we continue to benefit from it. It is our duty to learn, grow, and do better. I'm hopeful that our journey guides us to a respectful and harmonious future. At the beginning of our webinars, we also like to provide you with our equity statement, and this clearly outlines our expectations from participants. If you could please take a moment to review the statement, the link is in the chat box now. As noted, the Professional Institute of the Public Service of Canada strives to create a climate that is respectful, safe, and inclusive, where we all feel welcome and valued, and where we're supported to make our contribution and to support others to make theirs. We thank you for being part of this inclusive space. And lastly, before we get started, I just want to go over a few key facts about our platform, Zoom. So due to the size of the group today, we have muted all lines, and this is to ensure we have the best sound quality for everyone participating and for those who will watch later. Please use the chat box to send us a message should you have any questions for our guests or any technical issues during the webinar. My colleague, Catherine Gagnon, is managing the chat box, and she will be happy to help you out. And lastly, the session is being recorded and it will be circulated to everyone soon. And with that, let's get started. So as Debbie mentioned, COVID-19 has really amplified the dangerous state of long-term care in this country. For years, unions, doctors, activists, and families have been ringing the alarm and demanding that our provincial and federal governments step up and take this issue seriously. Since the COVID-19 pandemic took hold, we have watched in horror as infection rates and the death toll among seniors in long-term care facilities have skyrocketed. Even today, a report from the Canadian Institute for Health Information confirms that Canada has the worst record for COVID-19 deaths in long-term care homes compared to other wealthy countries. As the president of the Canadian Federation of Nurses Unions, Linda Silas has been supporting her members battling this pandemic and the catastrophic results of years of inaction on long-term care. Thanks again for joining us today, Linda. Can you give us a sense of the impact of COVID in long-term care and what you're hearing from your members?
Thank you, Candice, and thank you for doing the land acknowledgement at the beginning too. You have to realize that the shortage and the precarious working condition long-term care have been existing for 20 plus years. We're working on very old model that doesn't work for today's society and today's seniors, because when they end up in long-term care facility, they're really sick. We don't have different levels of care that we used to have in the past. So what we're seeing is this shortage, but also the impact it has had on the workforce. You're talking about a workforce without full-time employment, a workforce that goes from one facility to the other just to be able to pay the bills. No respect, poor pay, no sick time. You've seen campaigns across Canada on sick time. So all of this is also under dangerous working condition, and that reflects right on what you've just said on the CAI report. The CAI report that came out this morning or late last night on the state of long-term care sector, comparing the first wave to the second wave, yes, but also comparing long-term care internationally and in Canada is embarrassing. Where, just to make sure I quote the right number, Canada has had 69% of all deaths are long-term care. That compared to internationally, they're at 41%. Well, that's a 27% difference. What did we do so wrong in our rich country in long-term care sector for not moving forward? So we know that we have 1 in 5 positive case are healthcare workers. We know we've lost about 43, 44 healthcare workers to COVID-19. We have over 20,000 infected, often home at sick because of lack of PPEs. So we're in a mess in long-term care sector and in acute care sector on COVID, and we need to fix it.
I couldn't agree more. We've also seen that there is a clear difference between COVID infection rates and deaths in private for-profit long-term care versus public not-for-profit care. So for example, a Canadian Medical Association journal study of the pandemic's first wave found that residents of for-profit long-term care facilities in Ontario were disproportionately more likely to die from COVID-19 than those living at a public municipal facility. Can you provide any insight as to why that's the case? And what does that mean in terms of day-to-day working conditions for your members and the day-to-day living conditions for folks in care?
As the numbers you're quoting have been quoted a little bit everywhere. The Toronto Star did a big expose on comparing our public long-term care facility and our private long-term care facility, and where the money was going in the private facilities, which wasn't to take care of residents. So that's for Ontario. We've also seen unions like SEIU do research after research on the situation in long-term care and personal care workers, because they're the majority of the workforce in a long-term care facilities, and brought many, many recommendations on how to improve it, such as staffing. You've seen the horror stories of having 6 minutes to prepare a residence for their day, and that's the time watch that we're seeing in the private sector. But this is not only in Ontario. When the first wave of COVID-19 hit, it hit in British Columbia, and it was immediately hit in a long-term care, in a private long-term care facility. And that's where we start seeing lockdowns. But when you see lockdowns, what happens is the family can't go in. And we'll talk later about what happens when families and caregivers can't go in to help. So a lot of work to be done. But mostly it's because we've been using models of the 1970s for 2020.
Right. And you did mention one of the most devastating parts of all of this is the impact on families. I know that we've all heard many stories of families who are normally filling sort of these gaps in care for their parents or grandparents. And then during the pandemic, they were suddenly locked out. How has this impacted families?
Yeah. One of my mentors during all of this has been Nancy Johnson. She's a retired occupational health and safety expert at the Ontario Nurses Association. And now she works in her community in a community service. And what she saw and what she's been experiencing in her community is the fact that caregivers, families members weren't allowed to go into long-term care sector. And we have to realize that 35% of Canada's workforce, most of them women between the age of 30 and 45, something like that, provide care to an elderly. So you do your job, and then after your work, you go provide to a care to a parent, maybe not a sibling, but maybe a sibling. But 35% of us do that. So what we saw during COVID and during all these lockdowns is we lost that workforce, without calling it a workforce because they're not getting paid, but that volunteer base that was so needed. And it went down 36% across the country, where all of a sudden, long-term care workers were missing more than a third of their helping hands and the hugs and the feeding aspect of seniors. And on top of that, we've seen a decrease into medical visits. The seniors couldn't see their physicians, and the physicians couldn't go to the long-term care facility. That went down to close to 20%. So it is no surprising that that's where we've seen the highest level of debts. We've just mismanaged it from day one.
Thanks, Linda. And before I turn things over to Debbie to talk about your pension, Revera, and what PIPS has planned, I do have a couple of poll questions for our audience, and I'd love to hear your feedback as well. You should see this poll, up on your screen now. Oh, sorry about that. So, and I will note, if you don't see the questions up on your screen, it could just be due to a pop-up blocker, but I am going to read out the questions, and you should feel free to share your responses in the chat box with us. So the first question is, have you had a loved one living in long-term care through the pandemic? And the second question asks, have you had a loved one living in a Revera long-term care facility? All right, and I'll give folks a little bit of time to respond. Okay, great. I'll give you another few seconds. So if you haven't responded yet, please do. All right, so let's take a look at those results. So we can see that there's a significant number of folks that actually do have folks living in long-term care through the pandemic, and our sympathies go out to you because I know it's been an extremely frustrating and challenging time. And there's a good number of folks that have had folks in a Revera facility as well, which is, I think, an important thing to keep in mind as we have this conversation. And that brings us back to Revera and our campaign to make Revera public. This fall, PIPS President Debbie Davio sent a letter to the Honorable Jean-Yves Duclos, President of the Treasury Board. Debbie, can you tell us a bit about that letter and what inspired you to take action?
Sure, Candace. What's happening in long-term care is just abhorrent. I know many of our members were shocked to learn that our pension plan, the Public Service Pension Plan, is the sole owner of Revera, one of Canada's largest for-profit long-term care operators. And it's simply unethical for our pension to profit from providing low-quality healthcare to seniors. I wrote to Minister Duclos, as well as the President and CEO of the Public Service Pension Investment Board, underscoring that this investment doesn't meet the investment board's own ethical standards. And the responses we received were frustrating. Frankly, they didn't say much, and they didn't make any commitments to do any better. The thing about Revera and being owned by our pensions, it's not just about the horrific state of their facilities and the substandard care they provide. Revera's for-profit care and business model represents everything PIPS fights against. We know that outsourcing IT services for the federal public service is wasteful and inefficient, and the same is true of long-term care. We fought for decades to defend public services, including healthcare. Then in January, a report from an international tax accountability research group uncovered that Revera is taking extreme measures to avoid paying taxes in the UK, the US, and other countries. Not only did this report reinforce that Revera does not meet the Public Service Pension Investment Board's own standards of ethical investing, it highlights the shortcomings of Canada's requirement for financial reporting which leaves space for this sort of aggressive tax avoidance, something many of our members know all too well. So PIPS is not alone in this fight. We're joining PSAC, CAPE, and many others in the labor movement that represent workers in the federal public sector. And we are calling on the labor movement to help make Revera public. Other not-for-profit groups like the LEAP and the Canadian Health Coalition also echo this call. The labor movement and public healthcare advocates have been rightly demanding action on the state of long-term care in this country for decades. And we know that making Revera public isn't going to fix all the challenges facing long-term care in this country, but it's definitely a step in the right direction. As the sole owners of this company, we must speak up and demand that our government does better.
Thanks, Debbie. Still, it's natural for folks on the call today to have some questions. You might be asking, what does this mean for the pension plan? What about my retirement security? Here's the lowdown. As Debbie mentioned, the Public Service Pension Investment Board has ethical standards that must be followed. These don't only look at whether an investment is morally good or bad, but if the investment's actions, good or bad, make it financially risky. So even if we want to look beyond the fact that people are quite literally dying due to poor care in these for-profit facilities, the fact that there are dozens of lawsuits piling up and more to come means that Revera could hit some rocky financial times. Couple that with the International Tax Accountability Report about tax avoidance, and there could be some real trouble ahead for Revera and, by extension, our pension investments. You also might be wondering if this is possible. And we'll be honest, it certainly isn't straightforward, but it is undeniably urgent. We're calling on the federal government to facilitate talks between the PSP and provincial health ministries to move Revera long-term care facilities from private to public ownership to protect the lives of seniors. Outbreaks continue to ravage for-profit long-term care across the country. And in response, governments are stepping in. In Ontario, BC, Manitoba, and Quebec, governments have temporarily taken over management or supplemented management of private long-term care facilities where many deaths and infections have occurred. And Prime Minister Trudeau has said that everything is on the table when it comes to addressing challenges in long-term care. The federal government can and should look at this investment and facilitate conversations to make this happen. But we cannot do this alone. Sorry, there we go. We cannot do this alone. The labor movement and other advocates are calling to make Revera public. Our call is getting louder, but we need you to add your voice. It could really make the difference. Public campaigns are effective in holding pension plans to account. For example, in 2019, the Canadian Pension Plan, or CPP, which we are all also contributing to, ended its investment in American prison companies that were running migrant detention camps for profit as a result of public pressure. That's why we're glad to see there are so many folks online with us today and ready to join this campaign. And with that, we'd like to open things up for questions. I know that we've thrown a lot of information at you, and I can see that there are questions starting to sort of come in from participants. I'll remind folks to type your questions into the chat box, and we will read them out to Debbie and Linda. All right, so let me take a look at what we have so far. My first question comes from Drew, and Drew asks, I read an article a few weeks ago that a mere 55% of long-term care workers elected to get vaccinated against COVID-19. Do you have any information on this statement? Are you aware of any differences between vaccination rates of workers at public or private facilities? Obviously, that's a bit of a big question, but I'm wondering if Linda or Debbie have any thoughts on that.
I'll start, Deb. Let's remember that healthcare workers are just like any other Canadian. There is a level of hesitation when we're talking about vaccination, and regardless if it's the COVID-19 vaccination or the regular influenza. So that's what we're seeing in the workforce. We're not seeing a difference between the public and the private. We're just seeing a general hesitation. Because of that, CFNU is going to start on April 6 and April 7 a campaign to, more or less, it's called Trust Nurses, Get Vaccinated. People are asking why, how come it went so fast? Well, it went so fast because we're in a pandemic, and went so fast because all governments pooled their money together to create a vaccine. So I encourage everyone to take it, including the long-term care healthcare workers that were hesitating, because they are in the first priority list.
Yeah, I mean, certainly as a union that represents healthcare workers, and scientists for that matter, we're finding, the vast majority of our membership are in favor of vaccinations. But as Linda mentions, just like all Canadians, there are some holders out. And I think definitely as the unions that represent those workers, we're going to be advocating for vaccinations, not mandatory vaccinations, because that maybe crosses some line, but definitely promoting vaccinations, and all of us can do our part in that campaign.
Thank you for that feedback. The next question comes from Alexandra, and they're asking, what can we do as members to prevent the pension plan from going after companies like this in terms of investments? What can we do to push forward this campaign to make Revera public?
Sorry, Candace, I got distracted by other questions in the chat, and I'm very sorry about that. I didn't quite catch the first part of the question, so if you wouldn't mind repeating it.
I don't mind at all. There are a lot of questions coming in, and I know I'm having
I got sucked in, and I didn't pay attention. I'm sorry. I'll do better next time.
It's all good. This question is from Alexandra, and they're asking, what can the union do to prevent our pension plan from going after investments like Revera in the future? And in terms of right now, what can members do to support our call to make Revera public?
Okay, well, thank you for the question again. Certainly, we've already started some of this work, like our campaign to have you write to express your opinion on this topic. Those campaigns are actually more effective than you think, and ministers and people making decisions will be receiving sort of thousands of these types of communications that will actually influence their decision making. So that kind of advocacy is super important. But we have a seat at the Public Service Pension Advisory Committee where we have a voice, but unfortunately that voice does not necessarily have to be respected. We've written to Jean-Yves Duclos, who's the president of the Treasury Board. We've also written to the president of the Public Service Pension Investment Board on this issue. They both kind of point fingers at each other and say that, they're doing their best. But I think that this type of pressure, the campaign that we're running, the letters that you write, engaging in our actions will most certainly have some impact on those decision makers. And as I mentioned, we're not in this alone. We're working with the broader labor movement, people like Linda's union and others who definitely have the ear of the very senior decision makers in government. And, one thing that we have as a union, the only thing we have as a union, really, the biggest tool in our toolkit is our numbers, the number of people working together towards a common cause. And, we're up against people with big money. And the only way for us to combat big money is with our big numbers all standing together and pulling in the same direction. And that's what today's webinar is all about.
If I can add, Debbie, also last June, the Canadian Labour Congress passed a motion that we needed to create standards, national standards, similar to the rest of our healthcare system for long-term care. And that would mean that they're under a public administration. So that is key for your fight, for our fight to protect our long-term care sector.
Absolutely. And I'll just add to a little bit later in this presentation, we will be sharing some links with some online tools that members can use right away to take action on this issue. So hold tight, there will be more to come on that piece. Great. My next question comes from Laura, and this might be one for Linda to tackle. Could you elaborate on why private care homes seem to have a worse record in terms of COVID outbreaks and deaths compared to the public homes?
Well, it's all about administration, my friends. The private homes are administered by shareholders. Just by the term shareholders, it means their main responsibility is to the shareholders. So if there's any profit to be made, the money goes to the shareholders, not back into the care, even when the care have been dismal, as we've been talking about. So it is so important that when we're talking about healthcare, and I say it on every platform, healthcare is a human right, just like education. It's a human right, but it doesn't stop at the doors of a hospital when we're a senior or a person with disability, and we need that extended care into a long-term care facility or home care. There's different ones across Canada. It needs to be under the same principles as our healthcare system. So that's why there's a big difference. It's about the shareholders, not about the residents.
Thank you for that. My next question comes from Laura, a different Laura. I was surprised to hear that we were fully invested in Revera. It worries me that our pension plan could also be invested in other unethical or questionable companies. Are we watching out for that? What can we do to ensure that we're not invested in multiple problematic places?
Well, as I had mentioned, we do have a seat at the Public Service Pension Advisory Committee where we have a voice, and we're using that voice very loudly. And for sure, over the past few years, there have been reports that show that major Canadian pension plans, including the PSP and the CPP, are investing in companies that seemingly do not meet environmental, social, and governance standards. And part of the challenge is that ESG standards are not the only criteria applied to decisions around whether or not to invest in something, though in theory, they should be the deal breaker. That's what we hope for. Ultimately, a pension plan's core purpose is to make money, and a lot of it. And naturally, there's some tension between these two requirements of investing. So there's a much larger conversation to be had around ethical investing and how it relates to pension plans in particular, many of which manage billions of dollars worth of assets. And we know that PIPS members are very interested in learning about ethical investing, and we're planning to look at all aspects of this important issue in the future. So maybe a future webinar on this topic as well. But just for right now, for today, we're focused in on Revera. We're trying to make the difference on this one issue that we think is fundamental to helping our seniors who are caught in these homes.
Thanks, Debbie. My next question comes from Daniel, and it's directed to Linda. Daniel states, his opinion is that, care staff shouldn't necessarily be roaming from one long-term care home to another as part-timers to fill in hours for a living wage. And I can say, Daniel, I think we all agree with that. So the question is, what is your organization's recommendation or your recommendation for staffing and sort of dealing with that issue?
Well, it's simple. It's 70% of healthcare workforces, including long-term care, should be full-time jobs, 70%. And that recommendation comes Since the last nursing crisis, which was 97 to 99, and there was major reports in early 2000, where we all tried to up our full-time component in healthcare. The area where it lagged and always lagged was long-term care. And that's, in my opinion, why the crisis was hit so hard there. If you remember SARS in 2003 in Toronto, that was one of the main reasons SARS spread in Toronto, because we had nurses and other healthcare workers working in different facilities. Some of them would do an 8-hour shift in one facility, walk across the street in another facility, bringing all the viruses with them. And we saw that in long-term care this time too. As I said earlier, we have a hard time learning from previous lessons sometimes.
True.
Thanks for that. My next question comes from Melissa. Do we have an option for just sort of divesting from Revera? Is there a reason why we're calling to make them public as opposed to just sort of getting rid of the investment?
Yeah, for sure. That's an important question. If we simply, force our way on the divestment from Revera, somebody else is just going to become the sole investor, and the abuses will continue and the terrible conditions for our seniors will continue. So that's the really easy answer to that question. The important sort of direction here is to make Revera public so that there can be proper oversight, proper, adequate investment controls and regulatory protections for them.
Perfect, thank you. My next question comes from Brenda, and I think this is probably something the both of you might have thoughts on. What are some of the hurdles to making all long-term care homes, not just Revera, but all of them, public?
It's money. We have to realize that in healthcare, we spend about a little bit more than 11% of GDP for healthcare as a whole. But when we look at long-term care, we're one of the lowest in the world. It's about 1.3, something like that. The average is 1.7. So to transform all the private sector long-term care facility into public, we need a big injection. So we will need a long-term strategy to gradually transform them into public or not-for-profit. They don't all have to be government-owned. They need to be not-for-profit. And that's the key, and transform that. And one of the best ways is to have national standards to protect our seniors like we protect every other patient in this country.
Yeah, and while we agree that long-term care as a whole is in need of an overhaul, that's for sure, there's significant evidence that demonstrates that publicly owned facilities have fared better than the for-profit facilities, and that's why we're focused on this solution.
Right. My next question comes from James, and this is for you, Debbie. In your opinion, how many PIPS members are actually aware that their pension owns Revera?
You know what? I consider myself to be very knowledgeable on all things PIPS. As president, I've got no choice but to be. But I was taken by surprise by this piece of information. And it was brought forward to our attention, and we immediately took action. We immediately wrote to the president of the Treasury Board, who said, "Oh, it's not me." So then we wrote to the president of the Pension and Investment Board, and I should say that the Public Service Pension Investment Board has been quite successful in their investments, and so this goes back to the question of money. They want to make a lot of money, and in fact, we want them to make a lot of money. We want our pensions to remain sustainable, but not at the cost of healthcare to our seniors. There are other profitable investments that can be made without going against their own ethical standards on those types of investments. So we're going to continue to push for ethical investment. And as mentioned earlier, some of our efforts have resulted in the Public Service Pension Plan divesting from some private profit prisons in the States. And I, you know, not to get into what's all wrong with those prisons, but all sorts of things wrong. So, you know, we just have to really stay on our toes to have a voice and influence over those investments.
Thank you for that. I'm just taking a look. There are so many questions to choose from. It's really quite fantastic to see how engaged folks are with this topic. So the next question is related to sort of looking at that ethical investing question again. So, you know, if we're looking at divestment from this company on ethical grounds, and I'm sorry, this is from Katie, you know, is it possible for us also to advocate or look into other companies like oil and gas that have environmental impacts, mining, which has some human rights impacts? Is there anything that you can do around a robust screening process or any other sort of options to make sure that we are having sort of an influence, I suppose, on some of the things that the pension plan goes after?
Well, sorry, maybe that question came in before I had answered another question about those environmental and social and governance standards, which we will continue to push. There are ethical standards of the plan, and we believe that the investment in Revera do not meet those ethical standards. And so we will continue to monitor and raise our voices when the pension investment board is going outside of those standards that have been established. And that's exactly what we're doing here today. And we will continue to do, again, about oil and gas. I mentioned private for-profit prisons in the States where the conditions were terrible. And, you know, those are the kinds of investments that we don't think our pension plan needs to make to remain sustainable.
Yeah, and as you mentioned earlier, it's a really big conversation around ethical investing and sort of that tightrope between sort of meeting those principles and earning a profit to pay the pension as well. So we want to, I know personally, I'm looking forward to having that conversation because I think it's quite interesting, and I know our members are very keen on it.
I think it's, I think it's important to note, I mean, we are on it, but it's hard because oil and gas are a big part of the Canadian economy. And as you know, several provinces have, you know, had an impact on the wellness of our environment with their, you know, sort of economic reasons for pursuing, and big money. Again, we're up against big money, so we need big numbers. So I'm really glad so many of you joined today, but we will have to take actions if we're going to be going up against oil and gas.
Yes, I agree. So my last question for today is from Sarah, and this is about sort of leans towards the long-term care side of things again. So Sarah asks, doesn't Canada have among the highest percentage of long-term care residents in higher care? How does that sort of impact the results we've had when it comes to COVID?
Yes, Sarah is going into my initial comments that we have plans that reflects the 1970s. And in the 1970s, 80s, we had 4 levels of residence. So you had the walking around, you know, even had their car parked in the driveway, they would more or less take care of themselves. And level 4 would be bedridden or at least need 24-hour care. Now we're all at that level of bedridden or 24-hour care. And we have the highest level, but we also have one of the lowest level of hours of care. It is recommended 4.1%. Scientists will say 4.5% hours of care per residence. So that means direct care for each residence, and it's nursing care, but it includes personal care workers. And we have about 1.3, 1.7, sometimes 2.5, depending on the province. So we have a lot of work to do. And I'm doing like Debbie. I'm very impressed with your membership, Debbie. The questions are coming up.
I know, you guys
Yeah.
are amazing. Thank
Yeah.
you for being so engaged, because this is what drives us, and sort of your input in these types of webinars help to design our next steps on this issue as well. So thank you so much for your engagement.
So the question of hours of care is exactly that. It's not manpower, it's people power, but it's the nursing team, some personal care workers, licensed practical nurses, and the RN team, hours per residence per day. And what is recommended is 4.5. So think about your grandparents in a long-term care facility. If they're only getting about an hour, 2 hours, 2.5 hours a day, and they're sick, there's something wrong. And that's the
and you can't visit them at the same time.
And you can't visit them. And yeah, and that's about the 35% of care, because they're part of that care. I know when my mom was in a long-term care facility, it was volunteers that would go in every day to feed her, to make sure to have those discussions. Imagine from the lockdown, poof, they were gone. 30% of that caring aspect, that touching, that human touch was completely gone. And it has devastated so many seniors and so many families.
You know, both my parents are 83, but I'm so thankful they do not live in long-term care homes. They still live on their own. And but my admin's mother became ill and had to go into an LTC, and ultimately they had to pool their funds to pay for additional care for their mother in this facility, because there simply wasn't enough resources even to do adequate, you know, changing of soiled diapers, you know, cleaning. And these are the conditions leading into the pandemic. This wasn't during the pandemic. This was before the pandemic. And so the pandemic only highlighted what was already terrible conditions in these homes.
Absolutely. Well, thank you, Debbie and Linda, for all of those great responses. And thank you to all of our members for all of the fantastic questions. We do need to move on, but I'll remind folks that you can always send questions to us at bettertogether@pips.ca. This is really great for anything we didn't get to today. If you have follow-up questions, if there was anything a little bit technical that you wanted a bit more information on, please send us an email and our team will happily give you the information you're looking for, or connect you with the right member of our team to get that more specific information. As I mentioned before, we need your support, and your voice to strengthen our call to make Revera public. Here are 3 things you can do right now to help us keep that momentum. First, if you haven't signed our campaign pledge, do so now. You can find the link in the chat. We've already had over 3,000 signatures, and we need to keep building that momentum. The second thing you can do is share that pledge. You can post it on social media, send it through your chat group to your friends or your colleagues, send a text to someone, whatever works best for you. We're asking everyone who signs our pledge to find at least 5 friends to sign it as well. You can find links to ready-to-go Facebook and Twitter posts in the chat right now. And last but certainly not least, you can send an email to your MP. We've pulled together a great tool to make sending an email quick, easy, and effective. You'll find a link to that tool in the chat box as well. And just like the pledge, we're asking folks to find 5 friends to send emails to their MPs too. And those are 3 quick, easy things you can do to help our campaign right now, but we're just getting started. In the coming weeks, we're going to need folks to up their game. That means reaching out to more friends and colleagues, making phone calls, and much more. If you're in, we'd love to know, so that way we can reach out to you about all of the things that are coming up. You're going to see a poll on your screen in just one moment. And I'll ask folks to register their answers. So the question is, can we count on you to support our Make Revera Public campaign? Please check all that apply. So the responses are, yes, I will sign the pledge and share with my network. Yes, I will send an email to my MP and ask my friends to do the same. I'm interested in getting more involved with the campaign. And then there are options for folks who aren't sure or are not interested in supporting. So if you don't see that pop up on your screen due to your computer settings or a pop-up blocker, please feel free to share your responses in the chat box. I'll give you a few more moments to respond to that. Oh, and
People are
seeing that
saying
some
you
folks...
can only select one item. Yeah.
Oh no, all right, well, pick your favorite and we'll be following up with folks based on that. But of course, even if you pick one, you will be able to have the option to participate in all of the activities that are forthcoming.
Maybe if
but thanks for
folks
that.
selected the one option that is the most, you know, that has the most involvement necessary, and that way we know what their limit is.
Yes, yeah, that's a good suggestion. All right. Sorry about that, folks, but thanks so much for pointing it out, and we'll make sure we take a look at that. All right, I'm going to close the poll, but thanks to everyone for participating. We've got a lot of folks that we can reach out to help support this campaign, which is really, really exciting. All right, so before we wind things down, Linda, Debbie, do you have any final comments to share with our participants today?
Well, I had stuff prepared, but I'm going to switch it a bit. You know, during your talk, you talked a lot about ethical investments. And one of your questions when they were rolling in, they said, would you have done this campaign on Revera if we didn't have a pandemic? Well, we didn't know. But I think as a union and as a professional union, if you would have known that one of your investments was killing people, you would have had this kind of campaign. And I think that's what's important here, is that we work together in identifying the crisis that this pandemic has highlighted. And it is by working together. We really have to know where our money is going and what is ethical investment. And that has been going on since the 80s, since unions have been sitting at pension tables because it is our members' money. We have been working with many, many lawyers to make sure that our ethical investments are well balanced. And what is our line in the sand? Where do we want our money? And I think that's what's important here. And on behalf of Canada's nurses, I thank you for your hard work because it will be a long battle, but it doesn't matter. We're not scared of any battles.
Thank you.
Thanks, Linda. And thank you so much for joining us today as well to chat about this important issue. As I mentioned before, Revera represents everything PIPS fights against. And we fought for decades to protect our public services, whether that's the crucial IT services our members deliver or defending public health care. We consistently call on our government to crack down on tax cheats, yet we've come to know that our members' pensions are invested in one. We stand alongside our allies in the labor movement and healthcare advocates in calling to make Revera public. And the time to act is now. Our seniors are continuing to suffer and die in long-term care, and we can't let outbreak after outbreak pass with further inaction from our government while our pension profits. You can make a difference. There are 3 quick, easy actions you can take right now, as Candace pointed out, to support this campaign. Sign the pledge, share the pledge, and email your MP. Takes like 2 minutes of your time. And you really can make a difference, a significant difference, a meaningful difference. So thank you so much for joining us today. If you have any additional questions, don't hesitate to send them in at any time. Thank you.
Thanks, Debbie, and thank you, Linda. Just before ending today's session, we do have a few feedback questions for you. These feedback polls are completely anonymous and optional, and the results will not be shared with participants. Your answers to these questions will, however, help us make sure that we can continue to improve your webinar experience and help us deliver better and more relevant content to all PIPS members. So you should see 4 questions coming up on your screen now. So the first question is, on a scale of 1 to 5, with 1 being terrible and 5 being excellent, please rate your overall experience at this webinar.
This is new, so this is so we can self-improve.
Yes, exactly. The second question is, did you find this webinar informative? The third question asks you to identify your age. And the last question asks you to identify your gender. So I'll give you a few moments to respond. And once again, this information will not be shared with participants. It's just so that way we can gauge your feedback, your feelings about the webinar experience, and how we can continue to make things better. Because as I'm sure you know, we are running more and more webinars as we continue to all be working from home. And it's a wonderful way to connect, but we want to make sure that we are doing so in the best way possible. So I'll give folks a few more seconds to enter those responses. All right. I'll give you a few more seconds. If you haven't responded yet, please do. Okay, great. Thank you so much for that feedback and for your participation today. And that brings us to the end of our presentation. Thank you all for joining us. Big thank you to Linda and to Debbie for your expertise and your time today, and to Catherine for managing the chat box and all of those fantastic questions that came in. Once again, I'll remind folks that if you do have any outstanding questions about this presentation, our campaign, or frankly anything, please send us an email to bettertogether@pips.ca, and we will happily make sure that your question gets answered by a member of our team. So again, thank you so much. I hope you have a wonderful day.